in conceptualizing these panels, we wanted to really highlight the different areas of biomechanics in baseball and how we're all contributing to this conversation. And so today's panel will focus on biomechanics in baseball in academia. And so we have Dr. Rob Shapiro, who is a professor emeritus at the University of Kentucky and is the founding director of the UK Human Biodynamics Lab. He'll be moderating a panel that consists of Dr. Gretchen Oliver at Auburn University, Dr. Hilary Plummer from the Andrews Research and Education Foundation, and Megan Stewart, biomechanist at ASMI. Okay, so Rob, take it away.
Thank you. As Glenn pointed out, I've been at this for a while. Actually, my first biomechanics baseball study was in 1974, probably before many of you were born. So the topic today is baseball biomechanics in academia. And we're going to talk about students and expectations, and hopefully you all have questions about that. And I had prepared an introduction of the panel, but that's been taken care of, so I don't have to do that. So in my experience, and I've been teaching biomechanics, I started my first job in '77. There's been a considerable change in the students who actually come into the field. Originally, there were a lot of physical education students, and they were interested in sport, and they had some interest in science, and biomechanics kind of naturally occurred out of kinesiology. And physical education students did real well on the bio part of biomechanics. We didn't have a great background in engineering. And over the years, what happened is the transition, the technology changed, biomechanics became more readily available to people. They were more knowledgeable about it. Engineers became very interested in it. They were very good in the mechanics part, not so good on the bio part. Health science people who had interest in orthopedics especially were getting involved. Obviously, we know about Dr. Andrews, but there were a number of physicians before the ASMI was formed that were involved with baseball biomechanics. But there's been obviously a tremendous change with exercise science programs developing in the type of student that is coming into our graduate program. They're much better prepared. They're much more interested in health as opposed to just performance enhancement, which I think has really helped the field, because in terms of funding, trying to make a baseball pitcher pitch better is not necessarily fundable, but understanding mechanisms in the body that lead to injury certainly are. So our goal today is talk a little bit about students. Gretchen is right now the only person in this group that is actually running a laboratory and has access to students. So I thought maybe she could talk a little bit about the types of students that she sees and the broad, I think it's a broad spectrum of students from having had some conversation with her prior to this, and how they fit together and begin to think about questions related to baseball biomechanics. So Gretchen, if you want to talk for a few minutes, and we'll see if we get some questions, and we'll answer those as they come up.
Sure. Thank you, Dr. Shapiro. Basically, I created the Sports Medicine and Movement Lab in 2013, and we focus primarily on injury prevention and performance enhancement in baseball and softball, but those are the only two sports. So a student coming into the lab, that is what they're going to be expected to do research. We have numerous participants coming into the lab, and I guess at the end of the day, the expectation is that a student's coming in for research. They're going to come in and they're expected to publish, and they're going to be publishing manuscripts throughout their 3 years. And then once they get to their dissertation, then dissertation, it's just a formality. So I will say that the lab is very focused on trying to promote the sport of baseball, also the sport of softball. But we're trying to promote the sport and injury prevention and get the research out there. I will say one of the positives of us being so focused is that there is a huge collaboration amongst the PhD students because everybody's within the same literature. Everybody's reading the same type of literature and can help and can collaborate. So everybody's doing and moving forward. So you could say if you're a PhD student looking to do baseball biomechanics and come to Auburn University and work in the sports medicine and movement lab, then you would be expected to publish throughout, and it would be probably expected that you would have anywhere from 6 to 10 publications going into your dissertation, because that's every data collection is moving forward to further the sport. And so we're not just going to do a random study over here. We're going to look at the study. We're going to say what's known in the literature and where can that be of benefit. So everything that you're doing hopefully is moving forward towards something being published to help you go to the next level for dissertation, to go to the next level of, okay, where do I want to take this degree? Do I want to take this degree and purely be mechanist? Do I want to take this degree and purely be, I want to be on the field, or whatever it is? We try to fit you into where you're trying to go, but the focus is going to be on injury prevention and throwing.
Okay. Just to follow up a little bit, when a student applies to your program, what types of skills do you look for?
At the end of the day, it's really the want to. It's that they're going to go above and beyond. They have a intellectual curiosity. So if they don't I've had students excel in publishing with zero biomechanical background before they got here. It's that you have an intellectual curiosity, you want to learn and you want to be better every day, and that baseball biomechanics intrigues you.
Hillary, let me ask you, as the research director for a laboratory, what do you look for in a student that might come to you, either has just completed their PhD or is working on a degree and they're looking for work experience? What kind of skills would you like to see in the people that come to work in your lab?
Well, actually, I haven't had anybody that's has just completed their PhD work in my lab, but what I would look for is, like Gretchen said, they have to have a drive. They need to be motivated to do biomechanics, baseball research, publication history in baseball biomechanics research is something I would look strongly at. And just really the will to move baseball biomechanics forward, improve injury prevention in baseball players, things like that. So they can have a clinical background would be ideal for me, because I'm working with a group of orthopedic surgeons. So injury prevention is our main focus at the Andrews Institute. So it's definitely something, if they have a PT or athletic training background, that's always a plus for me.
Okay. So Megan, you're currently a doctoral student as well as a biomechanist for ASMI. From the student standpoint, what did you look for in a program for your PhD?
So that's a great question. I think that the biggest part for a student either looking for a master's degree or a doctoral degree program is to really focus on the advisors and who they would be working with the most. So to really do some background research on the individuals within the program they're applying for, to find out what kind of research your specific advisor has done in the past. So Gretchen touched on this, that everybody in their lab does baseball or softball research. And I think it's really important that your advisor's goals, both academically and in terms of research, are in alignment with your goals academically in research. So if you want to look specifically at baseball research or specifically at the shoulder or elbow or upper extremity, then the advisor that you go to the program for also needs to have research experience with the upper extremities, preferably in baseball. So if you go to a program and you're working with an advisor who only does lower extremity or ankle instability research, they're not going to be able to help you further your career, either academically or professionally. So it's more of choosing an advisor, in my opinion, than choosing a program. You're going there for that individual to help you grow, not just for the name on the degree that you're going to get.
Okay. I was hoping we'd have some questions, but we haven't gotten any yet. One of the things that
I have a few, Rob.
Okay.
One of them is, what differences in careers have you found with a master's versus a PhD?
Okay, that's a good question. What are, I know my students went to work for motion analysis. They went to work for Novell. They went to work for Vicon. They got university jobs. Most of my career, there were not biomechanics positions in baseball. After I retired, I just saw the Yankees, and that's Yankee Stadium behind me, were advertising for a baseball biomechanist. Almost came out of retirement, almost. So what other things are you all seeing?
I think as a student that was looking for jobs, when you have a master's degree, academic jobs are limited to lecturer positions for the most part. You're not going to be a professor without your PhD. So you really have to decide if you want to go the academic route or the research route. I was really focused on going to research and not academia, not teaching. And so there was a lot more opportunities with a master's degree, especially if you're trying to get your doctoral degree while you're working in the more research or industry route versus the academia route.
Okay. I see a question from a ringer in here, a fellow named Tim Uhl, who's one of the leading shoulder biomechanics experts in the country. Dr. Uhl actually was one of my first students at Kentucky. And his question is, what do we think a good undergraduate experience might be to prepare students for this? I think we've kind of almost addressed that. You can come from almost any field if you have the ability to ask questions. If you're interested in inquiry and you're willing to work hard. As I said early in my career, people came from physical education and had to go back and do math and engineering, and they became excellent biomechanists. Engineers coming in, go back and do anatomy and the biology end of it. So I think my experience is almost any field can lead you to biomechanics as long as you have that interest and are willing to work. So, see what else we have. Somebody asked us about the best programs for a biomechanics degree, and I can't answer that question.
You can look on the American Society of Biomechanics. They have a list of all biomechanics programs, and you can sort them as sport biomechanics to determine where you might fit best.
To reiterate what Megan had said previously, whatever your focus is, then you need to find those programs that do your focus. And then you look at those mentors, those professors that would be your mentor, and see what they have produced, and that's how you rate it. Because no, my lab is not known for any type of gait analysis. So if you're looking for gait analysis, we are the worst. However, so I definitely, you start and find biomechanics programs, then you go and find, okay, where is my niche? Okay, who are the professors doing this research? And then what has their lab produced in the past 5 to 10 years? And that's going to tell you if they're an active lab still doing that research, or did I do it 10 years ago and I'm not doing it anymore?
I think one of the advantages that students have now is the internet and all the social media to see what people are doing. You can do that virtual tour of all the labs and see what everybody's doing. You can video chat with potential advisors. And that's one of the things that I would strongly recommend. I agree with Megan and with Gretchen that you need to find a program that matches your interests and an advisor that you match up well with. From my experience, I know that if you have a student and advisor that don't match well, then it's not pleasant for either one, and often makes for a difficult time. So that's not from personal experience. I had a great advisor, both for my master's and my doctorate. But we've seen it happen over the years where there was just not a good mesh between student and faculty member. And in all fairness, in full disclosure, Megan was one of my master's students. So you have to disclose, right? So that's my full disclosure for today.
You were a great advisor.
Then I have to disclose that Hillary was my student as well.
So Gretchen, we can both be proud of what we did, I think.
Exactly.
And to add on to what you said, Rob, I think it's also important for incoming students to talk to the students that are already in the program, learn about the expectations, what they're going through. Don't just rely on what you find on the internet. Talk to people who are actually going through what you would be going through.
Absolutely. I think that's a great point. The students are the best, probably the best people to talk to as a future student. They'll give you the true scoop.